How to tell if you need pelvic floor therapy. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. This is a great question, and what I want you to do is grab a pen and paper. We're going to go over exactly how to tell if you need pelvic floor therapy. I'm going to take you through a screen that we do, basically questions. It was developed by a pelvic floor physical therapist. It's called the Kozayan Pelvic Dysfunction Screen, and it was developed by Nicole Kozayan. So what we're going to do is just read off these 10 statements, and what I want you to do at home is to just mark down how many yeses you say to these statements, and then I'm going to tell you what it means at the end of the video. Number 1, I sometimes have pelvic pain in the genitals, perineum, pubic or bladder area, or pain with urination that exceeds a 3 on a 1 to 10 pain scale, with 10 being the worst pain imaginable. Number 2, I can remember falling onto my tailbone, lower back, or buttocks, even if it was a long time ago when I was a child. Number 3, for this one, I'm going to give you several examples, and if you answer yes to any of them, you're just going to mark it down once, okay? I sometimes experience one or more of the following urinary symptoms. So these are all related to your bladder. Do you sometimes have accidental loss of urine, meaning do you leak, do you pee in your pants a little bit or a lot without meaning to? Feeling unable to completely empty my bladder? Having to go to the bathroom within a few minutes of just having gone? Do you have pain or burning with urination? Or do you have difficulty starting, or do you have frequent stopping and starting of your urine stream? So if you answered yes to one or more of those, you're going to just put a mark of like 1 for number 3. Number 4, I often or occasionally have to get up to urinate 2 or more times during the night. Number 5, I sometimes have a feeling of increased pelvic pressure or the sensation of my pelvic organs slipping down or falling out. Number 6, I have a history of pain in my lower back, hip, groin, or tailbone, or I have had sciatica. Number 7, this is another one. If you answer yes to one or more of these, you're going to just mark it as a yes for number 7. I sometimes experience one or more of the following bowel symptoms. Loss of bowel control. Again, do you have accidents? Feeling unable to completely empty my bowels, so it feels like you never really go completely. Straining or pain with a bowel movement, or difficulty initiating a bowel movement. So again, you might answer yes to one or more of them, but you're going to just mark number 7 as 1 yes. Number 8, I sometimes experience pain or discomfort with sexual activity or sexual intercourse. Number 9, sexual activity increases one or more of my other symptoms. What I mean by that is if you have sexual intercourse or sexual activity, maybe your bowels get worse, or you have pelvic pain, or your bladder symptoms come on. And then the last one, number 10, prolonged sitting increases my symptoms. Now that you took the test, you're just going to add up how many questions you answered yes to. In that, if you answered yes to 3 or more of those statements that I read off, you are 91% likely to have a pelvic floor issue or pelvic floor dysfunction. And in that case, your next best step is actually to work with someone like myself to reach out to a pelvic floor physical therapist who can explain to you why the symptoms that you're having is related to pelvic floor dysfunction and what can be done about it so that you can feel confident in your body, so that you can resolve the symptoms that you're experiencing and you can live life to the fullest. Sometimes I get asked about taking this quiz or this screen during pregnancy because, a lot of women are like, well, maybe it's just a temporary thing, and it may be, but it's still pointing to the fact that you are having some pelvic floor concerns, pelvic floor dysfunction. And so if you are currently pregnant and you've taken the test and you feel like some of your symptoms are temporary, it's still worthwhile to consult with a pelvic floor physical therapist so that you don't have long-term effects from the symptoms that you're having. And also, why suffer? Even say something like minor incontinence or minor leaking of your bladder is still a pelvic floor dysfunction. And it's still a sign that something is not working correctly. And it's something that can be fixed, even during pregnancy. So again, if you answered yes to 3 or more of those statements, I encourage you to reach out to us here at the Healing Spot. The best place to go is to our website, healingspotpt.com, and pick whatever option works out the best for you. Talk to a member of our team. Ask us whatever questions you would like so that you can get the answers that you need to make a more informed decision about your care and get the help that you need. Our therapists here at the Healing Spot work with people one-on-one in the clinic here in Colorado Springs, but we also offer virtual sessions as well. So head to that website and see if we can possibly help you feel better and live life to the fullest. Thanks for watching this Ed Talk. We'll see you on the next one.